Maybe you guys have heard this joke before, but how many libertarians does it take to change a light bulb? None. The free market will take care of it. So today I'm going to try to convince you that free healthcare is a fundamental right and that we should all support it. And that if you have any sense of justice and you care about the people least well off in society, then you should support free healthcare. Now, I'm doing a bait and switch here because I'm using it in the same sense that I support free trade, which means free from regulation and intervention. Now, when you, unfortunately, the range of debate in healthcare, which is, the topic of public debate right now, the range of debate ranges between the current system, Obamacare, and nationalized healthcare, like pretty much every other developed country has, right? And unfortunately, people from our perspective haven't done a good enough job of articulating what our system would look like and how it would work, right? It's very easy to say, well, just get the government out and the market will take care of it. But even if that is true, it's not a very effective argument because the people who have an aversion to the market in the first place, they don't see it that way because belief in the market takes a sense of faith that prices, incentives, and entrepreneurs are going to solve society's problems. And unless you have that kind of knowledge and belief that those incentives will be strong enough, then you're going to turn to, as Steve pointed out, the government to solve the problems. So what I'm going to do today is show how a market in healthcare, a free market in healthcare, would actually work, make it better off for pretty much everyone, and solve the problems. Because I believe that when you are trying to convince someone of your opinion, rather than just spout out what matters to you, you should first reach out and see what their concern is, and then see how you can overcome their concerns, right? And so the people who are supporting either Obamacare or single-payer health care, their concerns are the people who don't have access to health care, either because they're uninsured or for whatever reason. So we need to show how our system would fix that problem. So by the end of this, I'll give you my plan as a policy proposal of what it would look like. And it's fairly simple because I think actually the problems that cause the problems in our current system that lead to lack of access to health care and high costs are fairly simple. And I'm going to start off by showing the history of healthcare in the U.S. and how we got to where we are today. Now, one thing I should point out is that I did a research on a paper with the Independent Institute about 3 or 4 years ago, showing how most domestic welfare programs had their roots in wartime. And this is true also of almost all taxes started in war, social welfare programs, and then also the government's involvement in money and banking. And so war, as we all know, isn't very good for liberty, and it's also not very good for all these other areas, right? And this is also true of healthcare. So if you go back to the 1920s and 30s, we'll start at the 1920s. The healthcare was generally provided by you just pay for it as you purchased it, right? And then there wasn't a strong market in insurance or anything. The first croppings up were employer pooled insurance programs where it would be actually cheaper for the employer to offer a collective self-insured pool amongst its own employees, because you know that your coworkers are healthy. And so that would ensure that the cross-section is healthy. You're not going to have the problem where only sick people sign up and then you get the death spiral where only sick people are paying and only sick people are receiving. Now, what happened is during the Great Depression, when so there was such high unemployment, this started to affect how hospitals work. So they started creating what are called HMOs, or health management organizations, and this is where Blue Cross and Blue Shield started. And this was to ensure that you could prepay, so it'd be like a subscriber model. You would prepay for access to healthcare, and then when you got sick, you could go use it. And the real turning point in our system, though, was World War II. And in World War II, there were two pieces of legislation that forever changed how we do healthcare in America. The first was called the Stabilization Act of 1942, and it established wage and price controls that prohibited wage increases. But fringe benefits were exempt from the salary freeze. With most skilled labor force enlisted in the war, right, the young guys were overseas, employers began to offer health insurance as a way to attract and retain skilled employees. And another legislation that came out of the same month, in the Revenue Act of 1942, this established a 90% corporate profit tax, 90%, but allowed these fringe benefits to be deducted, counted as tax deductible. So if you look at the incentive for this, you can pay your employees insurance or fringe benefits such as health insurance, and you can deduct it from the taxes on the company side. You can deduct it from as tax-free income on the individual side, and you can skirt the price and wage controls. And so this led to a situation where over the next 20 years, this really stimulated the insurance industry. Over the next 20 years, the amount of people enrolled in insurance increased 20 times. And so this really was the government's intervention that really started America down its path. And in fact, Kaiser Permanente is a good example. They were started in the 1940s, and so a lot of other major insurance companies were started then too. So you can definitely trace a line. Then in Vietnam, so during this time, there was always a great push for socialized medicine. Teddy Roosevelt, then FDR wanted it as part of Social Security. That got turned down. Harry Truman wanted it, was unsuccessful. Finally, they were sort of successful when LBJ was able to get it passed. And this was under the Great Society. You know, he had the guns and butter. You're funding war in Vietnam, and then also had a leap forward in fighting poverty and increasing health care. So one of the concerns, Medicare provides health insurance for the elderly, and then Medicaid is for the poor and children. And one of the reasons for this was explicitly that young soldiers that were being drafted into Vietnam were not healthy enough to serve. And so we needed to make sure that potential recruits are healthy enough so they can go serve their country overseas. So even if you believed in the outcome or the intention as we see it now of certain welfare programs, we have to understand that a lot of these actually had nefarious origins, like food lunch program, and for the same reason that children didn't have enough nutrition to be healthy soldiers and stuff, right? So that's something to keep in mind. And then in 1974, they passed the HMO Act. And so already HMOs were starting to have a big presence in the market because of since World War II. But this really solidified it because it provided grants and loans, government subsidized loans, to start or expand an HMO, and required employers with 25 or more employees to offer federally certified HMO options if they offered traditional health care. Now, what they call traditional health insurance is what the insurance company calls, or insurance industry calls, indemnity insurance. And so the difference, I'm going to mention this because I'm going to come back to it because this is part of my policy proposal. Indemnity insurance covers the costs of what it would take to make you whole. And so the alternative is managed care. And managed care can be done either by the government, which is like Medicare and Medicaid, or private insurers are HMOs. These are called managed care. And there's been controlled experiments recently, like an Oregon study. Maybe you guys have heard of it. If you're into this, or if you haven't, that's totally okay too. But if you want to look more into it, you can see the results. There's controlled experiments of how managed care does not actually increase the health or well-being of the people, and it hardly, in fact, it often makes their financial situation worse because they end up spending more out of pocket on the health care, which was totally counterintuitive. But what it finds is that the alternative between how managed care works is the insurance company decides what treatment you get. It's not you, it's not the doctor, it's a third party. And that's very bureaucratic, whether it's done privately or by the government. It's still a bureaucracy. And so the other alternative is you purchase insurance that says when something bad happens, we'll pay you this much, right? So here's an example, right? With indemnity insurance, let's say you have property insurance for your house and your house burns down. Which sounds better to you? Say your house is worth $1 million. We can pretend, right? Maybe it is, if you live in DuPont Circle or something. I don't know how much your guys' house costs, but so you insure your house for the full value, and your house burns down. And one option is they cut you a check for the value of your home, and you go rebuild it however you want. You could build a bigger house if you want, or you could build a smaller house and pocket the difference. You choose. You don't have to choose the same floor plan or anything, right? Well, the other alternative is that the insurance company says, well, we're going to decide how many bedrooms and bathrooms you have in your house. We're going to decide which construction contracting companies you can work with. If you don't have any choice there, we're going to do all these decisions, and you're not really going to have any control over how your new house looks, right? Which of those models makes sense to you, and then apply this to the healthcare industry. So this is what I think is one of the major problems in our current system. So now the history also goes up all the way up to Medicare Part D, and then we have Obamacare. But you guys are probably familiar with that, and so I'm just going to skip over. But now when someone asks you, okay, you don't like Obamacare, what's your grand idea? America has, by some records, the most expensive healthcare, and we rank really low in outcomes and all these different kinds of things. Now, you can quibble over the accuracy of those statements, because once you dig into the numbers, there's a lot of things wrong with that. But I'm not even going to mention that right now, because I admit that there are problems with our current system. So here is my proposal. I have 4 key parts, and then a few other things that we can also do, right? So when most libertarians try to answer the question, what would you do? They start out with cut the FDA, or abolish the FDA, and do all these radical things, which if you're trying to convince the person you're talking to, sounds crazy to them, and so that they're not going to buy into your argument, right? Those might be things to do down the road, but you got to get the right order, of how to do things. And so the things I'm proposing are things that could be done immediately and out of basically no expense to the government or not really any disruption to current existing things. And then I have a few other things that we can debate that might be, these are kind of proposals of how maybe the free market would handle it. So number one is separate insurance from employment and remove the tax deductibility of health insurance, which has led to stagnating wages and rising prices. What you've seen is since this has happened, especially since the 70s, I would say this is one of the reasons why wages have stagnated. Now, there's other reasons too, but if you look at wages as in like direct money paid, and then if you compare that to compensation has gone up a lot, and wages have stagnated. So when people say wages have stagnated since the 70s, that's true, but that's kind of a half truth, like it's not taking in how much people receive in fringe benefits. And once you get to a certain financial stability or financial income, you're going to choose to take more benefits over direct income, but especially when you have the tax incentives. So separate it from employment. It's like, do you have to buy car insurance through your employer? No. And what sense would it make to buy it through your employer? Like, you have to choose, you can only buy that just doesn't make sense. So separate those two things. Repeal the legislation that subsidizes HMOs, like that 1974 legislation or 73, and bring prices back between the patient and the doctor instead of HMOs bureaucratically deciding which treatments they'll pay for. And number 3 is, instead of insurers paying the hospital, have them pay the patient, which is the indemnity style insurance, and the patient can choose how to spend their money. So this, for example, like, you could buy a policy that says if you get cancer, we'll pay you $200,000. And then you could take that money and decide which treatments, you and your doctor can decide which treatments would be most effective for that amount of money. And if the doctor says, look, there's really no chance, that you're going to make it no matter what we do, you might pocket the money and use that for your heirs, your children or your family members. They might need that money. So instead of the insurance company wasting it on treatments that aren't going to work anyways, right? If they'll even do the treatments. All right, so number 4 is health savings accounts. We have health savings accounts, but they're really restricted. One thing, we have a little bit of, experiment here where a country like Singapore, Singapore has a single-payer health system, and that they have catastrophic insurance, and it's forced, but they also have a big health savings account program, so that if you tax-free can put your money in there, and then you can share that with, if you get sick, you can pool that money with your family members, right? And so if your aunt gets cancer and her insurance doesn't cover all the treatment costs or whatever, your family can take it out of that tax-free account and pool it and spend it on that. So you get more control and you get more options to how you spend it. Right now, the way that the insurance is run, when you buy it through your employer and you get the big programs, the expensive policies that will cover your day-to-day expenses, or like a big thing right now is, birth control for women and stuff, right? Well, that doesn't make sense for why your insurance should have to cover that. That's something you're going to have to buy, right? That's like the equivalent of your car insurance company paying for your gasoline, So but if we had these health savings accounts, you could spend that money on how you want it, and the cost would go down for all these things because of that. When insurance companies are the ones making the decisions, they'll pay for things that people don't really need, and they don't really watch the costs. And then, so those are my core things, right? Separate insurance from employment, repeal HMO legislation, have health insurance accounts, and then do the indemnity insurance where you get a check and you get to decide how to spend it, right? And these are the optional things. Replace Medicare and Medicaid with subsidies for catastrophic insurance, to kind of wean it off. So you're not just slashing the programs outright. I mean, right now the government spends 50% of all the spending on health care, and most of it's in Medicare and Medicaid. So if you could provide catastrophic insurance for literally like 10% of the cost of what they're spending now, and this would just make sure that the people who are the very poorest, it's kind of like what Obama's trying to do with subsidizing on the exchanges and stuff, right? But it would only cover catastrophic insurance, and then you could have the health savings accounts cover the rest and kind of stuff. Here's another one, is that right now it's illegal to sell organs, right? And there's not really an economic reason at all to have that be illegal. I think the moral case for not selling organs is very weak if it's going to make both people better off, So that's at least something that should be up for discussion. And I have an idea of what the market might do if it were allowed to. I call it pre-selling your organs, right? So right now, like on your driver's license, you choose, are you a donor or not, right? But what you would do is you would go to a company and you would pre-sell your organs. They have the right to your organs if you die, and then they pay you while you're alive for that right. And in fact, what this would do is create an incentive where they want you to stay healthy, right? And that increases the market value of your organs. So what they might do is pay you more. They might buy you a gym subscription and pay you to go to the gym. They might pay you for keeping your blood pressure low and all these kinds of things, right? And so then you get market incentives, price incentives to stay healthy, right? And right now that's not allowed to happen. And the last thing is one of my optional things, which could happen more if the government was involved, is I call it a new lease on life. And this is for the people who, this wouldn't work for everyone, it'd be for the people who are relatively young and otherwise healthy and don't have insurance. They just, for some reason, weren't responsible and didn't buy it, even though they would have qualified, probably. And they have future earning potential, right? In this situation,